Hello and welcome to this short video looking at venous sampling. The purpose of this video is not to teach you how to undertake a blood sample. It's for those people who are novices, who are just starting out, to give them an insight into what it is like. And it's for the experts who need a little update because they haven't done the procedure in a while. The bloodletting system is a versatile system. There is a variety of tubes, many different colours, but they are simple to use, and we will run through that now. The blue tube is generally used for transfusion type procedures, and it has transfusion written on the tube. The red tube is generally a hematology type procedures, things like full blood count. The gold top brown coloured tube is a biochemistry type tube in general, used for biochemistry procedures such as liver function tests and urea and electrolytes. Finally, in this set of tubes there is a green tube. This is for coagulation type studies, and the important thing about this tube, it has to be a full tube, it has to be filled to the line. We have two systems with regards to accessing patients' veins for venipuncture. The most common system is a needle, which we will show you in a short while, being inserted into the patient's arm. And the other system is a butterfly system. Both systems connect to the bloodletting system in the same fashion. The blood tubes need to have the vacuum created. This is achieved by pulling the plunger back until the system clicks. At this point, there is a vacuum in this tube and you can dispose of the stick. The system is a push-on system, but it involves a twist. Once you've inserted the needle into the patient's vein, you can then attach the blood tube, like so. Once it is attached, it needs a slight turn, and that will lock the blood tube into place. If this needle was in a vein now, that tube would be filling with blood. It is important, once the sample has been obtained, that you twist and disconnect the tube. Disconnecting the tube prevents any blood leakage from the tube when you remove the needle from the patient's skin. When you are taking multiple samples, it is important to get the order of draw correct to prevent contamination. The first samples you need to take in a sequence of multiple samples is the coagulation and the biochemistry samples. The last samples you take in a multiple sample sequence is the transfusion and the hematology samples. Palpate the vessel to ensure that it's a vein and a healthy vein. Clean the skin for 30 seconds in multiple directions. As you allow the solution to dry, pop on your gloves. Hold the cannula in a way that you are not going to contaminate the hub or the catheter material. Take off the protective sheath. Apply skin tension in multiple directions. Sharp scratch. Look for flashback underneath your thumb, which you can see. Lower the angle down. Advance just 1 millimeter in. Then fix the cannula in place with your finger. Withdraw the needle by a couple of millimeters and you will see a second flashback along the edge of the catheter material, as so, and then you can advance the cannula. At this stage you can remove your tourniquet. And we tend to apply strips to secure the wings. At this stage we get a short extension with a pre-filled saline syringe attached. The tubing has been primed. We occlude the vessel just beyond the tip of the cannula. We withdraw the needle. A safety mechanism will activate. Immediately dispose of the sharp in the sharps container. Attach the short extension. And at this stage you can check for a little bit of blood return, which there is, and you can flush. You need to flush with between 5 and 10 mils. Once you've finished flushing, you need to clamp before you disconnect the syringe. That prevents blood aspirating back into the cannula and occluding your cannula. Once you've assured yourself that the cannula is in place, we can apply the final dressing, ensuring that it is well applied. And then the final application is a date strip with the date that you inserted the cannula that goes on the edge of the dressing without occluding the view through the dressing, so that you can monitor the site for any redness. Thank you for your interest in this short video. If you require any further information, please contact the Vascular Access team.